I'm here with Daniel Wubah. He is the president of Millersville University. Can you tell us a little bit about the situation at Millersville and how you've responded to the COVID-19 outbreak?
Okay, the campus is quiet. Our students are all gone. They've been gone since spring break. We were fortunate that just after the governor's directive to shelter in place, our students were starting their spring break, so we let them stay for an extra week to prepare the faculty to move online. So as we speak now, we have only about 33 students on campus who are living in the residence halls.
Now, how has this affected the spring semester at Millersville? How are students still taking classes? How are teachers teaching these classes?
Well, yes. We are in full session, but we've moved all our instructions to remote classes. So what happened was we gave the students a week off after spring break while the faculty members were being trained. So they took part in webinars on how to teach online. And we've been teaching all our classes online since then through the end of the semester. With regards to students being on campus, those we are housing now are mainly two groups: the international students who can't go home, and then students we currently consider to be shelter insecure, that they are basically homeless. We keep them on campus to be able to take their classes, but we are in full session, except we are using remote instructions, and the faculty members are teaching from home.
So what type of technology are professors and students using to take these classes and continue on with their schoolwork for the rest of the semester?
We are currently using what we call D2L. That is our main platform that we are currently using. And we were able to transfer over 700 courses onto that platform within a week when we decided to go online. And in addition to that, some faculty members have been using Zoom as well as Microsoft Teams. So we are using all these platforms to be able to carry out, our functions.
So Millersville University is a part of the state system of higher education here in Pennsylvania. How have all of those schools and the Chancellor of PASSHE worked together to respond to the COVID-19 outbreak on college campuses?
We've worked very collaboratively, and I've been very impressed about the leadership provided by our Chancellor. What happened was, once the governor gave the instructions, we meaning the Chancellor and the 14 presidents of the universities, started meeting twice a week. We call it, executive leadership group check-in. And so we started doing that in early March, and we've been meeting for an hour on Tuesdays and Fridays in the mornings. But in the past week, we've moved to 2 hours, on each of those days. So we are really, during these meetings, what we normally do is we share ideas and also share any problem that we see coming down the line as we prepare for the summer and also for the fall, while addressing immediate needs on our campuses. For example, the technology platform that we are using. And then we also spend a lot of time discussing how to refund, fees to students. So it's been very supportive, and our Chancellor has been very, very helpful in providing the right leadership.
Now, not only are students and teachers being affected by these closures and shelter-at-home orders, but the operations of colleges must be affected too. Can you talk a little bit about that and how the staff at Millersville is working to keep the university running while students are taking classes online?
Okay. Well, one of the most important efforts that we made at the beginning was what we call business continuity. So as soon as we shifted to this shelter in place, actually a week before that, we activated a group that we call Incident Response Team. And it's made up of about 45 members in our community, cutting across campus. So they meet twice a week, to basically figure out things that we need to address. And the impact of the COVID, as you said, it's not only on our students who are away now taking classes remotely, but our staff members. That we have employees who also had to stay away from campus, as well as our faculty members. And after the governor's administrative leave ended this past Friday, most of our staff members who can work remotely from home are continuing working full-time from home. But there are some who can't work remotely. So those people have been given the option of using administrative leave. So they are still paid, but they are using the administrative leave. And the faculty members are in full session because they are teaching their classes as scheduled.
Now, are there any resources that you're offering for students, faculty, employees to help them cope during this really difficult time?
Yes, we have a few that, we have put in place. For example, with the faculty, as I mentioned, right at the beginning, we provided them additional training to be able to teach online. With regards to our students, we actually ended up, our advancement office set up a fund called the EPIC Fund. EPIC comes from our value system: exploration, professionalism, public mission, inclusion, integrity, and compassion. And so we started a fund to help students who would need additional resources beyond what they can get, from home or what they have available. So students can access this fund. We currently have close to $30,000, and then where students can apply to get funds for whatever immediate needs they want. With regards to our staff, actually, I'm in the process of working with our human resources department so that we can provide some help to them in life-work balance, because for most of them, they are working at home, they have to support their family at home at the same time. So it creates additional stress for them. So we are working, we are looking for a consultant who would help us to help our faculty members as well as our staff members to be able to balance this stressful time.
Now, according to Spotlight PA, the state system overall is projected to lose $70 to $100 million this spring semester alone. What is your reaction to that number?
Well, actually, that would be a conservative, number, because, for example, at Millersville, we already have, based on the tracking that we are doing because of this pandemic, we've already lost close to $10 million, including the refunds that we had to make, and also the fact that we've canceled a lot of events on campus that would normally generate some resources for our campus, the revenues. And also our dining service is not operating, our bookstore is closed. All of that as revenues that we are currently losing. So I think the 100 million may end up being conservative, because if Millersville alone is losing close to about $10 million, you can imagine what our sister institutions are also losing.
So how does this affect the future of the state system universities? There are 14 of them. How does that affect all of those schools?
Well, that's exactly the question that we've been working on as the executive leadership group. And just before the pandemic, we were working as a team. As you know, the system currently is going through what we call the system redesign. So as part of the system redesign, we got to a point where we had developed basically our financial sustainability plans that we're going to use for the next few years. And then the COVID happened. Based on our projections now, we are actually coming up with version 2 of those sustainable plans. And the reason why we need that is all our projections are now out of the window, because we're projecting some positive earnings at the end of the year, which are all going to be negative. And we would need additional support when we come out of this pandemic that is going to basically come from several sources. We know that given the Commonwealth's challenge now in terms of the budget deficit, we are not expecting even to get the appropriations that we expected. So it's going to it will have some challenging times ahead of us. And that is financially as well as our programs. And that is what we are currently handling as the executive leadership group.
Now, how will the state system, the chancellor, and work with the legislature and with the governor's office to help solve some of these challenges that the state system schools are going to be facing in the near future?
Well, at the moment, the system redesign we had in place a plan to increase our efficiency and cut costs as much as possible. And at the moment, we have to cut costs deeper than we had anticipated previously. That is one way. And our Chancellor, too, is working with the governor's office as much as possible to prepare us for what is going to happen beyond the pandemic in the form of asking for additional resources for us. We know it's not going to be easy, but we'll have to definitely come up with cost-cutting approaches in order to be able to balance our budget. As we speak now on our campus, talking about one of the impacts of the pandemic, we've frozen all our hiring for positions. That's one, to save money. Secondly, we are looking for alternative ways by which we will decrease our expenditures between now and the end of the semester and beyond. So the institutions will have to come up with ways to cut down their costs, but at the same time, we'll also be seeking assistance from the Office of the Chancellor.
Daniel Wubah, he's the president of Millersville University. Thank you so much for your time.
Thank you very much, Kes.
PCN is committed to providing the people of Pennsylvania with the most up-to-the-minute information about coronavirus. Daily special programming with civic, business, and government leaders and how COVID-19 is affecting the community. Airing weekdays at noon and 8 p.m. Live special coverage of the Governor and the Secretary of Health, as well as programming designed to inform and assist everyone impacted. Go to pcntv.com for the latest information.
I'm here with Representative Kevin Boyle, a Democrat from Philadelphia. Can you tell me a little bit about the situation in Philadelphia right now?
Well, in Philadelphia, we are actually now close to 10,000 active diagnosed cases. It's the most overall in terms of the entire Commonwealth. It's not the highest per capita. I believe there are three other counties, Monroe and Lehigh, that are higher than we are. But in terms of raw numbers, we are the highest. And it is an alarming number because we all know that if there are near 10,000 diagnosed cases, there are probably 2, 3, 4, or 5 times as many cases that are actually out there.
And what concerns have you been hearing from your constituents?
Well, there's the public health aspect. People do not want to get sick themselves. They don't want to get, they don't want relatives to get sick, particularly those who are seniors or have pre-existing conditions. And then the economic reality of, the fact that we've been going through a shutdown for over 1 month now.
Now, what have you been doing in your offices, in your legislative district, and what have other legislators been doing to help support their constituents during this really hard time?
Well, I don't think my office has ever been busier. We've been inundated in my office here in Northeast Philadelphia with calls related to unemployment mainly. So that's been one component of what we've been doing in my district office. And that's actually where I'm located right now. I'm in my office in the Fox J section of Northeast Philadelphia. Tomorrow, I'll be joining a colleague of mine at Jean's Hospital to drop off PPEs that were actually a PPE drive that was organized by the local Chinese American community.
Now, besides representing your community, you're also the minority chairman on the state government committee in the House. Can you tell me a little bit about what type of legislation your committee has been looking at during this past month where we've been dealing with COVID-19?
Sure. The House State Government Committee has really been the epicenter of the state response to the pandemic. We have considered more legislation than any other standing committee in the House or the Senate. For the most part, the bills that we've been dealing with recently, though, have been more of a political nature, trying to limit the scope of the shutdown order from Governor Wolf. So just yesterday, we had a pretty prolonged fight on the floor of the House in relation to the Republican Party's efforts to end the shutdown for some sectors of the economy.
Now, as the House debates, what kind of arguments were being made to limit this shutdown that Governor Wolf has ordered, and what arguments were made to keep this shutdown in place the way that it is?
Well, I'll do my best to present the Republican side of the argument, but you saw the Republican leader, Brian Cutler. You saw the Republican administrator, Kurt Masser, rise to the House floor. And they were arguing that because there were some businesses that were allowed to operate, whether they be big box stores or stores or establishments that had gotten waivers at the very beginning of this process, that we should open up entire sectors of the economy, whether it would be construction or small level retail. I just fundamentally don't agree that just because maybe 2 to 3% of commerce has some sort of waiver, that we should open up entire sectors of the economy. I think that's very dangerous. I think that we need to continue to flatten the curve in Pennsylvania. The shutdown order is working, and the only way to get the economy back in a strong spot is to get the pandemic under control. We can't have a strong economy with a raging pandemic.
Now, what is the value of the economy being shut down, having businesses shut down? How is that going to help Pennsylvania in the long run?
Well, it's going to help the economy and also, most importantly, public health, this shutdown, because it's limiting the spread. Right now, if we were to, a month ago, or even right now, if we were to just to completely allow business as usual, you would have seen a massive spread of the virus. It would have overwhelmed the healthcare system. And one point that I think, unfortunately, a lot of Republicans in the state house don't understand, it's not just people that would acquire COVID-19 that would be impacted. If the healthcare system was overwhelmed, it would also limit the ability of people with other conditions to receive healthcare treatments. In some of the projections that we saw from Imperial College in the UK by the noted epidemiologist Neil Ferguson, he spoke about the overwhelming nature of COVID-19 without a shutdown order. It would overwhelm the healthcare systems, and people, many, many, many people would die because they just wouldn't be able to access healthcare that they need for other ailments.
Now, the state government committee also deals with elections and voting here in the state. How has elections and voting been affected by the coronavirus and COVID-19?
Well, we were supposed to have a primary on April 28th. That has been moved to June 2nd. And we have seen counties like Philadelphia, like Allegheny, and maybe some other counties in the near future begin to mail applications for mail-in ballots. So I expect you'll see more people utilizing the mail-in option for voting. And we also changed a provision in state law for this election and this election alone that would that local counties only have to have 60% of the same raw number of polling places as they did in last November's general election.
Can you talk about how you and your committee came up with this legislation and worked it through committee to get it to the House floor?
Sure. Well, I was responding directly to people here in the ground in Philadelphia, and also I represent a portion of Montgomery County. Local political leaders were coming to me saying they were not able to find people to work the polls. We were initially scheduled to have the election April 28th, as I was saying, and people were just unwilling to work the polls that day. And then another issue was just getting actual places to have the voting machines. That was another issue. And that's why we actually passed legislation, as I was mentioning earlier, that allows for counties to just have 60% of the same raw number of polling places as they did last November. So that pertains to voters right now. And I hope any voters that are listening and plan to vote in person on June 2nd, make sure that your polling place is still in the same location. There's actually quite the possibility that it will be at a different location for this election on June 2nd.
And how would voters be able to check on their polling place locations?
By calling their local county government.
Now, what resources are you making sure that the constituents in your legislative district have to help them during this really difficult time and to support them while some of them may not be working at this point?
Well, the people in my district who are not working, unfortunately, there's a lot of them. And we have a big composition of workers in my district that are construction workers. And we've seen construction go out of business in Pennsylvania right now. So every day we've probably been working with dozens and dozens of tradesmen and women to get them the unemployment that they need. That's by far been the biggest demand for people in my district here in Northeast Philly.
And we only have about a minute left. What other types of actions or legislation would you like to see in place to help fight COVID-19 here in Pennsylvania?
Well, I think the biggest thing we need to do is to acquire enough testing, because ultimately and hopefully in the near future, we can open back up. But we need to open back up in a responsible way. But when we do open back up, the only way to do it effectively, and this is where you see unanimity on both the right and the left, is we need to have appropriate testing, and we have to have the testing actually available to hospitals, to workplaces, so that we can monitor the spread if there is another outbreak.
Representative Kevin Boyle, thank you so much for joining us.
Thank you.
Join our guests for insights on issues impacting local government and the citizens of Pennsylvania. Created by the Pennsylvania State Association of Boroughs, Inside Pennsylvania Boroughs connects you to legislation and policy that will affect you and your family. Your host, Chris Kapp, and his guests discuss current affairs that matter to you most. Connect with your state by tuning into Inside Pennsylvania Boroughs on Sundays here on PCN.
I'm here with Representative Russ Diamond, a Republican from Lebanon County. Now, can you tell me a little bit about the situation in Lebanon County right now?
Well, Lebanon County is a very rural area. We've got a lot of farms. We've got a lot of poultry businesses. We also have the Lebanon VA hospital and Fort Indiantown Gap. So we've got a nexus of a lot of different things that are being affected by COVID-19 right now.
And how are the businesses and farms that are in your community being affected right now?
Well, the businesses, of course, are the same as the businesses all over the state. We're trying to understand why some businesses can be open, other businesses can't be closed. We're very confused about the governor's waiver list, that sort of thing. Worried about why the big box stores who can sell flooring right across the street from a flooring guy, one could be open, one could be closed. We don't understand that. As far as our farm community, there's some very big concerns right now in the farm community because some of the food processing plants are having trouble having some employees show up. You heard about milk being dumped. Same kind of thing is going on with some poultry and perhaps some pork. And it's getting very distressing to me because I understand that while I live in the country and I know a guy who, butchers his own pigs and I can get meat, that sort of thing. When we have those kind of interruptions at the beginning of the food supply, pretty soon they're going to show their faces in some of our more populated areas that don't have the alternative resources that we have right here in Lebanon County.
Now, what have the biggest concerns been from your constituents? What have you been hearing from them?
Well, the biggest concern is why can't I go back to work? Because in my place of work, I don't really get near anyone. I can wear a face mask when I do. I can make sure that my hands are washed and we disinfect everything that's in common touch. That's the real frustration that everybody has. On the very extreme end of that, I have got an independent concrete contractor whose house burned down on March 11th. And he's waiting for the insurance to work that out. But currently he's living with his wife and his 5 children in a camper down by the river. Literally, that's how they're living right now. He has not gotten paid, has not had work for 6 weeks. He tried to sign up for the PUA, and it's going to be another 3 weeks until he can get any money from that. So I'm trying to help families like that are in dire need, whose originally bad situation has been completely blown out of the water by this COVID-19 crisis.
So those constituents who are really struggling, where have the stem of their concerns come from? Why are they struggling? Why are they so concerned with?
Well,
with
they're struggling because a lot of people just live week to week to begin with, and they don't have the wherewithal to save up 6 months worth of savings to try to get through because they've got kids to feed now. So, and I think that's the common thread here, not just here in Lebanon County, but across Pennsylvania, in that people who were living week to week are now like, well, it's been a month, I signed up for unemployment, haven't really even got a whole big response from them yet, haven't seen a check yet. You can't expect people to live like that without any income whatsoever. And then on the other side of it, even the folks who have gotten the federal stimulus money or the extra $600 a week, it doesn't matter how much money the federal government puts into your bank account if once you go to the supermarket to buy the supplies that your family needs, there's nothing to buy. We've seen what's happened with the toilet paper. The toilet paper started about 5 or 6 weeks ago. Those shelves are still empty. I know they're being restocked, but they're being bought out right away. When that starts happening to food, that is a really scary place to be in the Commonwealth of Pennsylvania, especially if you're not in an area like mine where you have alternative paths to go and obtain some food for your family.
Now, what are you and your other representative colleagues doing to help these people that are really struggling during this time?
Well, the biggest help that we can offer is to answer the phones. Okay, we're answering the phones in our offices, offering constituent services, but it's very difficult for us because there is no way for us as legislators to get involved in speeding up the unemployment compensation program. There is no way for us to explain why the governor has made the decisions he's made about particular businesses being open, being not. We don't even have a list of those businesses because the governor has not been transparent on that. So that's what we're doing on one end. As far as what we're doing legislatively, we are trying time after time in the House of Representatives to get bills passed. We sent Senate Bill 613 to the governor. He vetoed it. I've got another bill that's similar. I don't even know if we're going to run that because we already know he'll probably veto it. So we've been running bills aimed at the construction industry specifically. We had a bill that was aimed specifically at mom and pop retail stores because we believe they can observe the same kind of social distancing and whatnot that the big box stores are. We're passing those bills. We're sending those to the Senate. So we're asking the Senate to pass those bills along. I just introduced another bill yesterday, House Bill 2429, that is related to garden centers. The governor has asked the USDA to help with some funding for safety for community gardens. And the Department of Agriculture has talked about the importance of community gardens as an alternative to that regular food supply chain that may get interrupted. However, a lot of garden centers are closed. So if you can't get the seeds to plant, it doesn't matter how nice of a community garden you have. So I have a bill House Bill 2429, which will make sure that every garden center is open in Pennsylvania so folks can get those seeds they need to get in the ground so they can have that alternative choice of a food supply chain right in their backyard or in their community.
Now, earlier this week on Monday, there was a protest in Harrisburg at the state capitol complex. Can you talk a little bit about what protesters were concerned about and why they were protesting at the state capitol?
They were protesting because they want their livelihoods back. You know, there's a lot of people in Pennsylvania who don't believe that collecting a check from the government is the right way to live. And they understand, because of the industries they work in, that when you interrupt supply chains like this, it is very difficult to get them back going again. These folks just want their livelihoods back. I know there was a lot of small business owners there who have put their life savings and their life's dreams into their business, and they are fretting because they don't know if they're going to actually have to permanently close their doors as a result of this lockdown or not. And my heart goes out to them. I'm a business owner. I've had my business for 28 years. I know what it's like to put your hopes and dreams into a business and then have the rug pulled out from under you. I don't know what that's like. I can't imagine what it's like to have the rug pulled out from under you like that. So I sympathize with them very, very much. I empathize with them very much. And I supported their effort to go out and rally and let the governor know what they were thinking. I wish they would have done a little bit better on the personal protection, wearing masks, social distancing, but that was compounded by the fact that the night before or the morning of that rally, there were barricades put up. If those folks would have been allowed to come up on the Capitol steps, there would have been a lot greater opportunity for them to do the social distancing. But it was what it was. They came out, they voiced their freedom of speech. their freedom to assemble. I support that wholeheartedly. And I hope that the governor got that message, at least in part.
Now, the House was in session on that Monday. Did you go and see the protest? Did you speak with protesters there?
I actually did. I was asked to speak to the protest, to the rally, and they had a podium and a microphone set up on the Capitol steps, which is, you know, pretty far away. I also did a Facebook Live video beforehand where I showed the crowds. I got a lot of negative feedback for that because people were saying, well, you're not wearing a mask. And well, I was doing social distancing. I wasn't closer than 10 feet to anybody. And then when we were waiting to speak, when I was with Representative Aaron Bernstein and Senator Doug Mastriano waiting to speak, of course, I wore a mask because that's the thing. And I think that really lends itself to a lot of people misunderstand the reason for people wearing masks. And I don't think the Department of Health did a good enough job of explaining that. It's not to protect you from getting the virus. It's to protect others from you accidentally coughing or sneezing or spitting when you're saying a hard pee on someone else. So it's not necessary to wear that mask when you're not near anybody else, but it is necessary when you cannot avoid practicing the social distancing. When people are close together, you absolutely need masks. And I wish people would understand that better. I wish the department would have explained that better. I wish they would just do a press conference where it's just kind of like a hands-on, let's tell you why it's the right reason to wear a mask out in public. Because there's a lot of confusion out there right now on why these masks are important. I think it's one of the more common sense suggestions or mandates that this administration has put out. And unfortunately, because it's been poorly communicated, it's been lost on a lot of people across Pennsylvania.
Now we only have about a minute left. What type of advice or what types of things would you want your constituents to know to help keep them safe during this really difficult time?
In the coming months or weeks, hopefully it's weeks, there will be businesses that are slowly opening up. I think for those people who aren't employers, who aren't business owners, but are consumers, are customers, you have to be aware of your own responsibility regarding your own safety and your own health. If you go to some place where you are not seeing evidence that they are making social distancing important, where you see evidence that they're not regularly cleaning or disinfecting or taking steps, you need to take it upon yourself to leave that place and for your own safety. I mean, if you're concerned about catching this virus, you need to be a little bit responsible for yourself because, I love freedom, I love liberty, but every liberty comes with responsibility. And right now, it's our responsibility to take care of our own health.
Representative Russ Diamond, thank you so much for your time.
Thank you for having me today.